Okay, real talk. It kills me when people don't believe in science, especially on vaccines. Yet for some reason, half our country still doesn't get the flu shot, and it's making the coronavirus crisis worse. I posted about this a week ago and couldn't believe the responses some people sent me, so I got an actual doctor to respond to your actual online comments.
I'm Dr. Edith-Bracho Sanchez. I am a pediatrician at Columbia University.
What does she say to the healthy American adults who say the flu shot is a waste of time? Like Charles B., who writes on Facebook, the flu shot has been notoriously ineffective recently anyway.
There's two ways that you think about effectiveness when it comes to the flu shot. One way is protecting you from getting the flu in the first place. It's not a perfect vaccine, I acknowledge it, but you need to get it.
This year's vaccine has been about 50% effective. Well, science tells us that means you're 50% less likely to get influenza and 50% less likely to spread influenza. The other thing it can do for you is build up your immune system in case you do get the flu virus anyway.
And in those group of people, the unlucky people who got vaccinated and still got it, the flu shot has been shown to decrease the complications from the flu.
Comment number 2 from Tracy S., who writes, I don't get the shot because I have watched multiple people get sick right after getting the vaccine.
So people who get the flu shot might get a little fever. This happens with a number of vaccines, and it is not a bad thing. What it means is that your immune system has seen the vaccine and is activating itself. It's saying, let me go ahead and make the antibodies, make the protection.
Since the flu shot doesn't use a live virus, you can't get the flu from it. And if you do get sick right after you got the shot, well, science tells us it was probably from a virus you caught just before or just after you got your inoculation. Facebook friend Daniel D. writes, they are worthless if your immune system is fine.
This concept of I have a strong immune system, therefore I'm just gonna let it fight whatever I come across, it's just silly. So when you vaccinate, for everyone to understand, what you're doing is you're giving your strong immune system an advantage before you see the real deal.
The CDC says anyone over the age of 6 months should get a flu shot every year unless you have a rare allergy or disease. And the Affordable Care Act made it free for the majority of us too. Then there's Michelle, who writes, we need to get sick every once in a while to build up our immunity to illness.
Trust me, your immune system is fighting every single day and exercising and flexing those muscles to keep you from getting sick. All you're doing when you're vaccinating is you're giving your immune system an advantage.
She adds, when you develop antibodies, you protect yourself and your family. And you help reduce the load on our overstressed hospital system, which is more important now than ever. Or as Patty S. writes on Facebook, simply, people who get the flu shot help protect you and your family.
When it comes to vaccinating in this country, unfortunately, people have taken a somewhat selfish approach. I don't need to vaccinate, my child will be fine, I will be fine. This is the time to think about everyone around us and decreasing what we call the burden.
So what can you do? Get a flu shot. It really never is too late, because even a little bit of building of your immune system is a great thing. Also, share this message, share this science, because there's a lot of bad information out there on social media, and we need to stamp it out the same way we're trying to stamp out a virus.